Signs in aortic regurgitation. Aortic regurgitation, also known as aortic insufficiency, is the reverse blood flow from the aorta into the left ventricle during diastole. It can result from either valve leaflets or primary aortic root disease. Only aortic regurgitation is more common in males. Mitral valve disorder with aortic regurgitation is more common in females. A few common causes of aortic regurgitation include congenital bicuspid aortic valve, rheumatic heart disease, infective endocarditis, and aortitis. Symptoms of chronic aortic regurgitation develop gradually. It includes exertional dyspnea, orthopnea, paroxysmal nocturnal dyspnea, angina pectoris, palpitations, and head pounding. On examination for aortic regurgitation, cardiac signs include widened pulse pressure. The apical LV impulse is hyperdynamic and displaced laterally and inferiorly. A prominent systolic thrill may be palpable at the base of the heart and over the carotid arteries. S1 is normal, but S2 is narrowly split, with loud A2. A high-frequency, glowing, decrescendo, diastolic murmur is heard in the third intercostal space along the left sternal border. It is appreciated at the end of expiration, while the patient is leaning forward. It increases with isometric exercises and decreases with maneuvers that decrease blood pressure. Austin Flint murmur is a low-pitched rumbling, mid-diastolic murmur, heard best at the apex. It is thought to be caused by premature closure of the mitral valve due to the jet of aortic regurgitation. Extracardiac signs include lighthouse sign refers to blanching and flushing of the forehead that occurs with each heartbeat. Landolfi's sign is an alternating systolic miosis and diastolic mydriasis in both pupils. Becker sign is the presence of visible pulsation of retinal arteries through an ophthalmoscope. De Musset's sign is the anterior-posterior bobbing movement of the head, synchronous with the arterial pulse. Muller's sign is the back-and-forth pulsation of the uvula. Quink's capillary pulse is the repeated flushing and blanching of the capillaries in the nail beds and lips. The Corrigan's pulse is a bounding carotid pulse, characterized by a rapid systolic rise and a rapid diastolic collapse. To detect the Corrigan sign, inspect the base of the patient's neck, right where the carotids are. The Water-Hammer pulse is a bounding pulse, with rapid systolic rising and diastolic collapse, that can be appreciated at either the radial, ulnar, or brachial artery. It is accentuated by slightly lifting up the patient's arm. Bispherian's pulse is caused, due to biphasic pulse, due to the backflow of blood in early diastole. Traub's sign or pistol shot sound is heard, while auscultating over the femoral arteries. It is possible to hear a pistol shot sound, both during systole and during diastole. The sound can be accentuated by compressing the femoral artery with a stethoscope. The quality of this sound is very similar to the Korokov ones used for measurement of blood pressure. De Rosy's sign is a diastolic systolic murmur, heard when applying firm pressure with a stethoscope on the femoral arteries. The sign is positive only if both the systolic and diastolic murmurs are heard. The diastolic murmur becomes louder when more pressure is applied on the distal rim of the stethoscope. Hill's sign is considered positive when the difference between the systolic blood pressure measured at the foot and at the arm is greater than 20 millimeters of mercury. Rosenbach's sign consists of systolic pulsations of the liver that can be appreciated by palpation of the right upper quadrant. Gerhardt's sign is described as systolic pulsations of the spleen, felt on palpation of the left upper quadrant. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED, the easiest and fastest way to take advanced clinical history.